So a pleasant day, dear doctors, and welcome to this final coaching masterclass in public health with focus on epidemiology, public health concepts, which is actually from the Public Health 101 module from the Centers for Disease Control. I will be inserting some important pearls which are lifted from the University of Liverpool master's class and the Harvard Medical School Public Health Key Concepts. So this is Dr. Toom, your master guru. Let's begin the session. So these are basically the topics which we should cover in about 3 sub-modules. The first is on public health, from the key concepts, definitions, up to the history, as well as the clinical application of public health, not only into examinations, but also into the healthcare system of the country that you are going to practice in. I will also reintroduce the concept of epidemiology, health surveillance, and prevention effectiveness. Now, these are the things I've worked very hard for in the last 4 years during the pandemic. So this is how productive I was. This is for the Master of Public Health, as well as the leadership in medicine and public health certification. So a lot of the things I'll be mentioning are actually key points, which is a universal language. It's a universal language which is used worldwide. And that is how in-depth the actual PLE has been in the last years. I would say last 3 years. I hope it will continue to focus on the same topics and the same key concepts. So let's begin with the first module. This is about public health definitions and key terms. So let's begin with who first coined public health. So this came from Winslow, and he defined this as the science. So that means there's scientific data, and the art of preventing disease, prolonging life, and promoting health. So what are the 3 P's here? First P, prevention. Second P, prolong life. What's the third P? It is promotion. Okay, it is health promotion. So these are the 3 P's in public health. Prevention, prolongation of life, and promotion. Now, please take note what makes public health different from the healthcare approaches or paradigms that we have in the hospital, because this is through organized efforts. That means the community is involved. Organizations are involved, both public as well as private communities, and of course, individuals. So this is a collaboration of health. And always remember that in the collaboration of health comes also 3 levels of disease prevention. Can anyone tell me what are the 3 levels of disease prevention? What are the 3 levels of disease prevention? So first, we have the primary, we have the secondary, we have the tertiary. So always remember, where does immunizations and vaccinations fall under? Where does immunizations and vaccinations fall under? Okay, that is under primary. Okay, it's immunizations. Now, what about prompt diagnosis and treatment? Under what level is that? Prompt diagnosis and treatment. That is under secondary. And of course, we have tertiary, which includes rehabilitation and prevention of complications. So these are the three levels of disease prevention. In the three levels of disease prevention. Now, according to the Institute of Medicine, they considered that the main mission of public health is to fulfill the society's interest in assuring conditions in which people can be healthy. According to the World Health Organization, public health aims to provide maximum benefit to the largest number of people. Now, what is the definition of health according to the WHO? It is not merely the absence of disease and infirmity, but the complete well-being of an individual, which includes social, mental, and if I were to redefine the term, it also includes spiritual, as well as cultural, economical, and even political well-being of an individual. Now, question. Let's see how in-depth your attitude is towards public health. Does politics play a role in the health of an individual and the health of a community? Yes or no? Politics. Okay, the answer is a big yes. Now, what about culture? Does culture and religious beliefs play a role in public health? Culture and religious beliefs. Okay, the answer is also a big yes. Okay, now, so these are the more or less key points in public health. We have protection, prevention, and promotion. Okay, protection, prevention, and promotion. So please take note of that. Okay. Now, let's do a knowledge check right now. And I want you to fill in the answers wherever you are watching this session from. So this is what we call a short answer question, or a SAQ. You have multiple choice question. You also have a SAQ, or a simple response. So the question is this: public health aims to provide blank with the right to be healthy and live in conditions that support health. Is it groups of people or is it individuals? Okay, correct answer is groups of people. Now, in the Philippine healthcare system, what do we call the subject where medical students get exposure to the community, become health promoters and educators? What do we call that subject? Okay, it is preventive and community medicine, PCM. And it is a requirement that you have at least 1 month of community medicine, preventive and community medicine. Okay, PCM. You cannot graduate from internship without that 1 month rotation. Now, fill in the blanks. A blank is a disease occurrence amongst a population that is in excess of what is expected for a given time and place. Is it A, pandemic, B, intervention, C, an epidemic or outbreak, D, prevention? So correct answer is C, an epidemic or an outbreak. Now, what if I tell you there are several cases of cholera in one community? Is this an epidemic or is this endemic? Okay, now please take note, there is a qualifier here. Cholera can be endemic in a region or an area. What makes it an epidemic is if the disease occurrence is in excess of what is expected. Now, what about one case of smallpox? This is usually asked in exams. What is one case of smallpox? One case of smallpox is already an epidemic. Why is it an epidemic? What is the explanation why one case of smallpox is considered an epidemic? Okay, because this disease has been eradicated. Was it eradicated or eliminated? Smallpox, is it eradicated or eliminated? Okay, it was eradicated. So we expect 0 cases. So if one case of smallpox shows up, then this is in excess of what is expected. Therefore, it falls under the definition of an epidemic. Tomorrow, I hope you'll take time to take about 2 hours off your schedule. I'll be talking about the epidemic curves. I'll be talking about the different principles and formulas which are applied in public health, as well as in epidemiology and research. So please do tune in and follow me tomorrow. Now let's go to the history of public health. Now, everything actually began during the time of the Greeks and Romans, and this began with the practice of community sanitation measures. In the 1840s, the Public Health Act was first established in the United Kingdom. And that is why, would you happen to know what are the top 2 universities or institutions for public health worldwide? Or let's just say, let's use United Kingdom, but it's actually worldwide. What are those 2 institutions which are found in the United Kingdom, which if you want to learn from the best, it's in public health? Number 1 is the London School of Hygiene. Does this sound familiar? The London School of Hygiene. Okay. Next to the London School of Hygiene is the University of Liverpool. Okay, the University of Liverpool. And would you happen to know who is the only graduate, Filipino graduate of the University of Liverpool? Just curious. The only Filipino graduate of the 3-year program of public health in the University of Liverpool. There's only one Filipino. Okay. So FYI, that's not going to come out in the exam. Now, the Americans, the United States, in 1970 established the Environmental Protection Agency, okay, with goals to protect the environment. Now, these are the 3 pandemics I want everyone to memorize. You need to be familiar with this. Number 1 is influenza, the famous influenza pandemic. This was in 1918. The polio pandemic, okay, followed. And when introduction of the vaccine was done, they were able to eradicate polio. But now, presently, is polio eradicated? Yes or no? Okay, the answer is no. So what is it now? Is it eradicated or eliminated? Polio. Polio has been eliminated in certain countries. But in the Philippines, is it eliminated? Yes or no? Polio. Okay, the answer is no. And what are the 2 polio vaccines that you're familiar with? One is oral, the other is injectable. So we have the Sabin, that's the oral, and we have the Salk. Okay, those are the 2 vaccines. Now, the next pandemic is HIV. Okay, the next pandemic is HIV. Then we have biological warfare. I hope you guys remember the plague, which was actually used as a bioterrorism weapon during the siege of Kaffa. Can anyone tell me what the organism is? What organism causes plague? What organism? This is the bubonic plague, or what we call Black Death. Okay, so this is caused by Yersinia pestis. Then, in pursuit of preparedness for disaster response, came, of course, the 9/11 attacks. Okay, in New York. Then we have Hurricane Katrina. Now, in the Philippines, what two major typhoons triggered the alarm for disaster response nationwide? Okay, very good. One is Typhoon Ondoy. The other is Yolanda. Does anyone remember what the other name of Yolanda is? What is the other name of Yolanda? Okay, this is Super Typhoon Haiyan. That's the international name. Okay, Haiyan. Do you think these disasters, let's go to the Philippine setting, do you think these disasters affected the health status of the nation? Do you think? Okay, the answer is a big yes. Okay. Now, the concept of prevention through policy actually goes back way back during the period of the Greeks and the Romans. The first written health code, everyone memorize this. This is the book of Leviticus. And would anyone happen to know what was the first code of conduct that was written? This is the same code of conduct with individuals used basically in their communities. What is this code? This is the code of Hammurabi. Okay, code of Hammurabi. A lot of our present ethics is based on that. Then other prevention through policy activities would include the tobacco laws, and that including obesity. And what hormones pop into your head when you hear obesity? What hormones? What hormones? Give me three hormones. Leptin, ghrelin, and adiponectin. Leptin, ghrelin, and adiponectin. Hope you got that. Now, knowledge check. Which of the following events in public health history have been pandemics? Is it A, the siege of Kaffa, B, influenza, C, polio, D, Hurricane Katrina? So correct answer is influenza and polio, both. Okay, there's two answers there. And what is the latest pandemic? This is a no-brainer question. We have, of course, COVID-19. which has totally changed the outlook, the approach, and policies of public health and community medicine. Now let's go over the public health approach. And everything begins with these steps. We need to ask ourselves, what is the problem? What is the cause? What works? And what you do it. Now, please tell me, what is this? When you use scientific data to determine who is getting sick, what is making them sick, and how can you prevent others from getting sick? What do we call this? What very important public health terminology is this? Who is getting sick? What is making them sick? And how can you prevent others from being sick? This is your classic descriptive, okay, epidemiology. So please remember this concept, descriptive epidemiology. When it comes to what is the problem, okay, this is when you'd have to bring in the concept of surveillance and monitoring. Then when you ask the question, what is the cause? You are now identifying risk factors, whether they are modifiable or non-modifiable. And when you try to answer the question, what works? This is when intervention as well as evaluation comes in. And of course, how do you do it? That is the implementation. Again, that is the implementation. So surveillance, risk factor identification, intervention evaluation. Then we have implementation. Okay. Now, these are the public health core sciences. So encircling public health is epidemiology. We know this is going to come out. Laboratory, informatics, surveillance, and prevention effectiveness. Right now, since I belong to a university that is trying to produce mga doktor para sa bayan, doctors who will be assigned to geographically isolated and economically depressed areas, we have included core epidemiology and preventive community medicine as early as first year. And as early as first year, we have included informatics, okay? Because that is a very essential tool in public health. It's one of the core sciences in public health. Now, please allow me to mention this because no public health discussion would be complete without the famous cholera outbreak found along Broad Street. And this involved eventually the man who would be dubbed as the father of epidemiology. Who is the father of epidemiology? Please do not answer Dr. Toom. Okay? Okay, who is the father of epidemiology? It's John Snow. Okay? John Snow is a doctor, okay, who is best known for tracing his work about a cholera outbreak. And he is considered as the father of modern epidemiology. I told you again, what are the top institutions for public health? It's this school, London School of Hygiene and Tropical Medicine. Then we have the University of Liverpool. Now, this is the famous map that was made by John Snow. So this is basically where everything begins in the concept of epidemiology. What is the problem? So here you will notice there's a cluster of cases represented by these dots. Okay. What street is common to all of these clusters? If this is 1, this is 2, this is 3, this is 4. What street is common to all 4? Okay, very good. This is the famous Broad Street. Okay, there was a water pump. Okay, on Broad Street, everyone had the same source of water. Now, what did you notice here in these areas? What did you notice here? Look, what can you tell me just by eyeballing? Okay, yes, there are fewer or lesser cases, okay, or sparse cases, the farther it was from the source of the infection. So what do you think was the problem here in the cluster of cholera cases along Broad Street? What do you think the problem was? Okay, it was really the water source. And the water source was the handle, okay, the handle of the water pump. What did John Snow do? Okay, does anyone know what John Snow did? Because he was looking for the problem, he made this map and he realized, okay, after making this map, okay, this map is what we call a spot map, okay? After making this spot map, he decided to remove the handle of that water pump. And significantly, the number of cases now started dropping. Bakit kailangan malaman nyo to? Because no public health course begins without this story of John Snow. Okay? So here, in risk factor identification, what was the first step? What was the first step? Go back. Okay, in epidemiology, what is the problem? Then comes the risk factor identification. What is now the cause? Okay, what is the cause? So they noted the cluster of cholera cases in association with this pump site. These are actually cases and deaths. Okay, the dots you see are deaths. Okay, so please take note of that. So please take note of this. Those are the pump sites. Now in the intervention evaluation, this now answers the question, what works? Okay, this now answers the question, what works? So here, through continuous research, what Dr. John Snow understood was the interventions were required to, number 1, stop the exposure to the contaminated water supply, okay, and stop the exposure to the entire supply of contaminated water in the area, okay? Now, can anyone tell me the famous outbreak of cholera, which is mentioned in your Harrisons? This occurred in Mexico. In fact, they named a strain. They named a strain of cholera based on this area. Anyone? Okay, this is called El Tor. Okay, very good. That's El Tor. Vibrio cholerae El Tor. That's from El Tor, Mexico. Now for the implementation, okay, how do you do it? Because of the data that John Snow gathered, he was able to make the British government create a new policy, okay, regarding providing or the provision of safe potable water. So he was able to convince the British government that the source of the cholera was actually contaminated sewage with the Broad Pump. FYI, you guys know what this is? What is this that I encircled? So up to today, the famous Broad Pump, okay, the water pump on Broad Street is still there, okay? Now, let's fill in the blanks. Each public health core science helps us to blank and to blank the public's health by providing public health practitioners with the answers that they need. So what are the P's here? So number one, to protect. Number two, to promote the public's health. Protect. Then we have promote the public's health. So please take note of this. Now, let's have a knowledge check. So match each component of the public health approach with the questions they answer. Does everyone still remember this? The public health approach: risk factor identification, surveillance, implementation, and intervention evaluation. So what is the problem? What component is this that answers what is the problem? Okay, so that is surveillance. What is the cause? This is, of course, risk factor identification. What works? That's intervention evaluation. And lastly, how do you do it? That is now the implementation. So please take note of this. You guys still good? Kaya pa? Please be advised that this is the actual, okay? Let me repeat, this is the actual CDC course materials, okay? The actual. Now, let's go to the core functions and essential services of public health. So please take note. There are different concepts which are more in-depth in the Philippine setting, and that's what we're going to take up tomorrow morning. So there are three core functions in public health. Number one is assessment. Number two is policy development. Number three is assurance. Three core functions of public health: assessment, policy development, and assurance. So when you say assessment, this involves the systematic collection, analysis of information and data. This involves healthy communities. For the policy development, this involves the promotion of the use of scientific knowledge, okay? And it will be applied in both policy as well as decision-making. Assurance ensures the provision of services to those in need. Now, consider the Philippine setting. Are Filipinos given assurance regarding their health? Filipinos in general. The answer is no. So what can you identify in the Philippine healthcare system? Anyone? So in the Philippine healthcare system, who actually is the first contact in the community? Who is the first contact in the community? Okay, very good. It's the barangay health worker. And the barangay health worker, its equivalent into international public health, is the village healthcare worker. Okay. What else do you notice? There is an inequality. Inequality in what sense? What inequalities can you identify? Okay, what inequalities can you identify? So one, income. Two, okay, livelihood. Next is basic health services, particularly access. Okay. And something else very important is the doctor-physician ratio. Can anyone tell me what is the ideal, according to the WHO, doctor-to-physician ratio? What does the WHO say? It should be 1:1,000. Okay. Philippines is what? 1:36,000. What they report is 24,000. It's actually 36,000. Okay. They're reporting the 20,000. It's 36,000. So there's an inequality. There's lack of delivery of services. There's inaccessibility, inaffordability, lack of human resources, lack as well as of infrastructure. And if you notice, does the patient pay own pocket? Yes or no? If they have PHIC, theoretically they should be covered, but the patient still pays own pocket, especially if the services or the diseases that they have is not part of the case rates. Okay. Now, these are the 10 essential public health services. And you will realize when we talk about the Philippine version, it is more precise, at least for our setting. So these are the 10 essential public health care services. We have health monitoring, diagnosis and evaluation, information, education, and empowerment. This is what the Philippine context dwells on more: education and community empowerment. Our setup, because of our healthcare system, is we are trying to empower the community to be responsible enough to take care of their basic healthcare needs. So don't forget, there's also geographic inaccessibility. They might be in far-flung mountainous areas or far-flung coastal areas. That's why healthcare services cannot reach them. There's community partnership. There's policy development. There's law enforcement. There's linkages to primary or provider care. There's also going to be a competent workforce. Do you think the Filipino healthcare workforce is competent? Yes or no? Competence. Personally, I'd say yes. Now, do you think they are enough? Do you think we have adequate number of competent workforce? The answer is a big no. There is a scarcity of healthcare workers. There's also brain drain. Classic example of brain drain is that when you graduate, are you really applying what you took up, the course that you took up? For example, are all doctors of medicine practicing medicine? Yes or no? Okay, the answer is a big no. There is now migration. Aside from migration, there's a change of courses. Some would go into nursing to go abroad. Some would become PTs to go abroad. So do you think this situation is significant in the impact of the healthcare status of the Philippines? Yes or no? Okay, it has a very, very big impact. Okay, that's how I want you to approach this subject so that you'd have the right principles in your head and you cannot go wrong during the answering of questions. Now, knowledge check. Which of the following is not a core function of public health? Is it assurance, assessment, authority, or policy development? Okay, try writing the actual answer so that it will stick in your head rather than writing a letter so that it will stick in your head. Okay, so the exception is authority. Therefore, what are the core functions? Assurance, assessment, and policy development. These are the core functions. Now, what about this? The essential health services of monitoring health and diagnosing and investigating disease relate to which core public health function? Again, you're being asked about the core public health function. You are being asked about the core of public health function. So answer, okay, it is assessment. The answer is assessment. Now, what about the roles of the stakeholders in public health? So first, can you guys tell me who are the stakeholders in public health? Let's think of the Philippine scenario. Who are the stakeholders? I'm going to start with the government. And what is the major government, the main government agency for health in the Philippines? Okay, we call it the Department of Health. And the Department of Health is actually under the umbrella, okay, of what international agency? Under the umbrella of what international agency? It's the World Health Organization, okay? World Health Organization. So tell me who the other stakeholders are. The government, okay? Who are the other stakeholders? You need to understand the concept, okay? So in this case, we have a decentralization. So the DOH, then you have the local government unit. In this case, it's going to be the barangay, okay? Who are the other stakeholders aside from the government? We have the medical personnel. And who are the medical personnel? Doctors, nurses, okay, midwives. Okay, what else? Healthcare provider. Yes, that's correct. Who else? MDs, RNs, midwives. Okay. Who else? Nursing aides. Okay. Who else are the medical personnel? Okay, very good. The med techs, the PTs, the OTs. Okay. Med tech, rad tech. Okay. And don't forget, you also have another stakeholder, which are your pharmaceuticals. Okay, where will you get medications? Then you have government agencies. You also have non-government agencies. Okay, can you give me some NGOs which are related to health? What famous NGOs are related to health? Okay, Red Cross. Oh, that's good. Okay, Red Cross. What else? There's Red Cross. There's Blue Cross. PCSO is government. Okay. What else? What about PHIC? What is PHIC? PhilHealth. Is that government or private? Government or private? PCSO is government. GOCN. Okay. Red Cross is government. NGOs. Yeah, Boitis is actually correct. Okay. What else? Just name a few. UNICEF. Okay. Yeah, UNICEF. So these are just examples. Okay. Now, what stakeholder is missing? You might want to include under GOs the International Monetary Fund or the IMF. Okay. So what other? Okay, perfect. Number one is the patients. Number two is the community themselves. Okay, these are the major stakeholders. Now here, this is to show you the partnership in the public health system. So to ensure the conditions of the population. So here's the community, that's your partner, the government, okay, the academe, the media, businesses, and of course, the clinical care delivery system, or what we call the CCDS. So please take note of this. So these are the partners in the public healthcare system. Now let me show you this. So examples of non-government organizations. So in our case, we would have the Philippine Medical Society, some local chapters. Okay, you have the Philippine College of Physicians, the Philippine Academy of Family Physicians, Cebu Medical Society, Quezon City Medical Society, Misamis Oriental Medical Society. Okay. Foundations. Okay. You know the Bill Gates Foundation. Okay. We have foundations. These are very, very important. You know the foundation of CDB? What do we call the foundation of CDB? That leads medical missions, gives medical scholarships, as well as spearheads the assistance, medical surgical assistance. Okay, very good. We call it CDB Cares. And that has been active since 2008. Okay. That has been active since 2008. Now here, in consideration of public health, as well as healthcare as a partner in public health, there's the public sector, there's the private sector, okay? There's the use of laboratories. There's going to be a difference because in healthcare, the focus is the individual. Memorize this. In public health, what is the focus? It's the population. Can you repeat that right now? What is the focus in healthcare? What is the focus in healthcare? It is the individual. And what is the focus in public health? It is the population, or in our version in the Philippines, we refer to the population as the community. Okay, the population is the community. Okay. Now, Other partners, so the media is very important. Health promotion, health communication. It also serves as a vehicle for public disclosure. Now, during the COVID pandemic, do you think media was beneficial at all times? Yes or no? Was it beneficial at all times? Listen well. Okay. The media was not beneficial at all times. Okay. There was now the concept because of the pandemic, fake news. Okay. And misinformation. One classic example is the vaccine. What versions did you hear about the misconceptions of the vaccine? They mentioned you'd become a zombie. Okay, there's a microchip which is inserted in your brain. Okay. Oh yeah, ivermectin. Oh boy. Let's not get there. Let's not talk about that because that's an interesting story. Okay, vaccination and even the severity of COVID. Okay, there was news circulating that it's just a common cold, that no one dies from it. Okay, then we have the employers and the businesses. That's why a lot of good companies have wellness initiatives. And we have the government agencies, which play a very important role in planning, education, as well as building up the concept of health in all the policies that they have. Are you aware in government agencies during the flag ceremony, what is required of every government worker during the Monday flag ceremony? Who are those PGIs who rotated in a government hospital? You are supposed to exercise, and it's usually Zumba. For how many minutes? What is the recommendation? How many minutes of exercise per day? It should be at least 30 minutes. Okay, there is the exercise. Then, of course, we have the academe, where education, training, research, and public service comes in. And what famous Republic Act is now providing free medical education to deserving students who might not be able to afford medicine? What is that famous Republic Act? What do we call it? Okay, that is what we call the Doktor para sa Bayan Act. Okay, so what is the establishment here? What is the premise of this Republic Act? The premise here is there should be regional health centers. Okay, classic example is, what does Manila have? Manila has the heart center. It has the lung center, has the orthopedic center. Okay, this is what is meant by centers. Now, would anyone happen to know what Vicente Soto has in Cebu? Okay, we have a regional heart center. Okay. We also have the regional lung center already. And we just basically blessed our new building, which is the regional cancer center. And hopefully by next year, we're going to have the brain and the spine center. Okay. This is the mandate of the previous government to bring these centers of excellence at a regional level rather than having everyone travel to Big Manila. Now, do you think this is a good plan by the DOH and the Philippine government? You think this is a good plan, yes or no? The answer is actually yes. Okay, it's a very big yes. You've heard of this. This might come up in your boards. Malasakit Center. Okay. Are you aware of this? Those rotating in public hospitals. This is the financial aid for patients in the hospital. It's called the Malasakit Center. This has a very big budget. So aside from that, you have the no balance billing. What does that mean? No balance billing. What does no balance billing mean? It means when the patient is discharged, they don't pay a single peso. And when the patient is discharged, they don't pay a single peso. You need to be aware of these things. There's a lot of legal terminologies as well as jurisprudence that actually comes out in the PrevMed exam. So you need to anticipate that. Now, let's have a knowledge check. We are now talking about the stakeholders and the role of these stakeholders in public health. What serves as a vehicle for public discourse? What serves as a vehicle? Okay, this is, of course, the media. So again, is the media good or bad, or it can be both? Is it good? Is it bad? Or it can be both? Okay, you need to be aware of that. It can be both. That's why if only media was used, in a responsible way, then yeah, that would be quite amazing. Okay. Now, health in all policies. Okay, I want you to remember that's now where the government comes in. Education and training. This is where the academia or the academe comes in. Then you have wellness initiatives and benefits. So that's where the employers and the businesses come in. So determining and influencing the public's health. So these are the health determinants. What will determine the state of health of an individual? One, genes and biology. Their health behaviors, or what we have, what we call in the DOH, health-seeking behaviors. Okay, health-seeking behaviors. There's characteristics, social as well as societal characteristics, health services, or medical care. Now, let me throw this concept. Why do you think there is now an increase in the prevalence of diabetics in Filipinos? Let's see if you're keen enough to catch things. Can you give me some reasons or factors? Okay, hey, that's pretty good, huh? Lifestyle, totally agree with that. Okay, better access to diagnosis and testing. So that means you get to detect more cases. Okay, lifestyle, that includes the diet. Yeah, agree with that. What else? Food trends, very good. Cheaper junk foods. Okay, what else? So lifestyle includes the sedentary lifestyle. Yeah, social media has an influence as well. How about culture? You think culture has a role in why there are diabetic Filipinos? You think culture, in what sense would culture be significant? Are you guys aware that we are the only country that has only rice? Are you aware of that? The only rice, crazy. Okay. Yeah, you have pasta, you have pancit, may kasamang rice pa. Okay. So that alone, that cultural aspect increases your risk already for developing DM. Okay. That's why in the American culture, let me put this at the side, American culture, they now have what we call, okay, super sizes. Kung may large, there is super large. Okay? That is why the government has required them to display the nutritional content of all the foods. So you'll know how many calories it is. You'll know how much protein and sodium you're getting, particularly the calories. Okay? That is an example of how health has been translated into policy and it has been translated into legislature. Now, let me use this example. There is an outbreak, okay, related to uncooked hamburgers. What disease is that? Outbreak associated with uncooked hamburgers. There was fever, there was headache, there was decrease in sodium, there was cough. Okay, this is classic what? What is uncooked hamburgers? Okay, this is hemolytic uremic syndrome. Okay, there's fever, there's headache, there's diarrhea, and all these systemic manifestations. So what legislature was now added because of this outbreak? They now required that fast food joints would have to cook burgers at a certain temperature for a certain period of time. One classic example of how health has been turned into policy, the COVID vaccine. Are you aware that there are establishments before that would only allow vaccinated people to enter? Do you still remember that? Do you remember that even the PRC required that you were fully vaccinated or you had a vaccine card when you take the board exam or when you gather in groups? So this is how health can translate into policy. Okay. So what determines the health of a population? Look, what has the biggest impact? The top three. Okay. Society, health behaviors, and access to medical care. That is what determines the health of a population. Now, this is the famous health impact pyramid. So what is the base? What did you notice the base is? What is the base? Can you type in what the base is? What is the base of this pyramid? That is the foundation. That is the core. And what do you think is the socio-economic status of the general Filipino population? Are we rich or not? What do you think is the socio-economic status of most Filipinos? We are near the poverty line. Okay? Do you think poverty is associated with more diseases and poorer health outcomes? The answer is a big yes. Do you know what the healthiest countries are? Switzerland, Japan, New Zealand, okay, Sweden, Germany, New Zealand. Okay. What is the common denominator with these countries? What do you think is the common denominator of these countries that are the healthiest in the world? They are first world countries. They are developed countries. Not developing, not low to middle income. They are developed countries. Okay. So now do you understand the health impact with regards to these multiple factors? I want you to understand that rather than memorizing some freaking handout. Okay? Understand. Now, look, this is now examples concrete examples of actual interventions. Okay, so here is on the right is the individual effort. Sa tao yan. On the left is the public health impact. So you have to remember, you don't want the public health impact to go down trending. Okay? Now, I want you to type in the chat box because this will stick in your head. List the 4 determinants of health. What are the 4 determinants of health? There you go. Okay. Genes and biology, health behaviors, social and societal characteristics, health services, or medical care. Okay. So these are the 4 determinants. Then fill in the blanks. As we move blank, the health impact pyramid, the public health impact grows greater. Go back to this pyramid. Okay. As we move up, what happens? Okay. So let's go. Okay. As we move down, the health impact pyramid. As we move down, the public health impact grows greater. And as we move up the health impact pyramid, the amount of individual effort increases. So please take note of that.